Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Yesterday we finished 173 to 260. So today we'll try to finish 1 to 172 in the FMGE 2025, the most recent paper. What is the congenital anomaly? So neural tube defects is a favorite question of the examiner. You should know how to identify the myelo means spinal cord, and spina bifida and encephaly, etc., etc. What are the two signs on ultrasound, doctor? Antenatally, lemon sign and banana sign are the two signs antenatally. Now, which structure is afferent for corneal reflex? The fifth nerve, trigeminal, will perceive the white of the eye, and eyelid closes, and it is the seventh nerve, which is the efferent, is what we need to remember. So take it as my word. Every NEET PG exam, one question will come on either vagus, facial nerve, trigeminal, oculomotor. Now, quickly tell me, what are the cranial nerves that arise from the midbrain?
3 and 4.
Third, 4, midbrain. 5, 6, 7,
Pons.
and everything else, cranial nerve nuclei are there in the medulla. A patient with a normal wrinkles on the forehead and ability to close the eyes presents with the lower half of the face on the right side. That is element type of paralysis and the infranuclear. And that will be typically contralateral to the side. Sorry, it is an upper motor neuron type. Only lower half of the face is involved. Upper half is bilaterally innervated. See, if you look at the cranial nerve nuclei in pons, each nuclei is controlled by both the sides motor cortex. But if you look at the facial nerve nucleus, it has two halves, upper half of the face, lower half of the face. If you look at the upper half of the face part of the nucleus, it is bilaterally innervated. That means all our forehead and all. But the lower half of the face is only supplied by the contralateral side, cortico-bulbar fibers, from cerebral cortex to the cranial nerve nucleus in the pons, seventh nerve nucleus in the pons. That's the reason whenever there is any upper motor neuron palsy, upper half of the face is not affected. Only the lower half of the face, which is only innervated by the contralateral motor cortex, that is the one which is affected. That's the reason if your right lower part of the face is affected, that means the left upper motor neuron lesion it is. Entire left part is involved, then it is directly at the level of the facial nerve nucleus, infranuclear. Understand?
Yeah.
So please remember, what is that? Suppose if you are, what is the question asked? Normal wrinkles on the forehead, ability to close eyes, that means upper part is spared. There is a paralysis of the lower half of the face on the right side. That means left upper motor neuron lesion is there. That's the reason right lower half of the face got involved. Suppose that's the reason, what do you call that as? Left seventh supranuclear is the answer. Supranuclear lesion affects the contralateral lower face only, sparing the upper face due to dual innervation. So that is the reason. What is your answer? Because right side lower half is involved, left side supranuclear lesion, upper motor neuron lesion is there. B is the correct answer. Okay. So that's the story of facial nerve. A child presents with facial asymmetry at rest and on smiling. Image was shown. It is Bell's palsy. Bell's palsy involves the entire half. It is a lower motor neuron type. Either facial nerve or the facial nerve nucleus, either of them are affected. Then the both upper and lower part of the nucleus get destroyed. So this is an entire half of the face got lost, is what we need to remember. A person cannot maintain the balance immediately after the roller coaster ride. So which part of our brain will be controlling our balance, doctor? Vestibulospinal tract. Vestibulospinal tract. What is vestibulo? Fundamentally, eighth cranial nerve is called vestibulocochlear. Your semicircular canals will be controlling your angular acceleration. You have utricle and saccule, which will be controlling the linear acceleration. So that entire thing is called vestibular apparatus. Cochlear means whatever you are hearing now, that is cochlear part. So the vestibulospinal tract is the one which will enable you to maintain the normal balance, is what we need to remember. So what is meant by pyramidal tract? Corticospinal tract. That is, cerebral cortex will come up to the pathway starting from cerebral cortex will come down up to the lower part of the medulla ipsilaterally, go to the contralateral side and control the anterocon cell. That's the reason corticospinal tract is pyramidal tract. Why it's called pyramidal tract? Because pyramidal cells of beds in the motor cortex is the one which is controlling. The anterocon cell is also under the control of, right, some pathways which are called extrapyramidal pathways. What are they? 4 pathways. Somebody? Vestibulospinal, reticulospinal, rubrospinal. गुर्जुना एक जमाने में हमने फरमाइश किए చెప్పండి reticulospinal, rubrospinal, tectospinal, vestibulospinal. అందులో vestibulospinal tract is the one which will maintain the balance, is what we need to basically remember. Okay, good to see 4 online classmates. Excellent. Can you please punch, doctor? Is the voice loud and clear? Please punch. Is the voice loud and clear for all of you? Now, tonsillar anatomy mein, tonsil is sitting and layered by buccopharyngeal fascia. That has been shown. It is the outer covering of the pharynx and it is a continuation of pretracheal fascia. See, vertebra undi kada, trachea, esophagus, ivanni kuda enti, they're all going into the posterior mediastinum, just before the spine. So that is the reason this fascia which is overlying the trachea is called pretracheal fascia. This pretracheal fascia, trachea to about pharynx together. So it will be forming the outer covering of the pharynx, which is called buccopharyngeal fascia. Right? So if you look at a tonsil, the fascia which is surrounding the tonsil is nothing but, that is a tonsillar capsule, is the condensation of the pharyngobasilar fascia around the palatine tonsil, right? And buccopharyngeal fascia is present and an outer covering of the pharynx. Then pharyngobasilar fascia based on the skull base. Pharynx ki skull base ki pharynx is inner facial lining of the pharynx above the superior constrictor muscle. Who has got superior constrictor, middle constrictor, inferior constrictor? Esophagus. Muscle is superior, middle, inferior constrictor. Pharynx continues as esophagus, no? Yes. So this is very difficult to crack. A typical question. Unexpected. Accident. Don't worry about accidents. A patient has congenital diaphragmatic hernia in the posterolateral region. Anterolateral enti? Morgagni's hernia. Posterolateral enti? Bogdalek hernia. Diaphragm undi kada. Diaphragm anterolateral, posterolateral. Right? So anterolateral is? Anteromedial, correct. Retrosternal anterior is Morgagni. Posterolateral is Bogdalek. Bogdalek is the most common orifice through which the abdominal intestine goes into the thorax is what we need to remember. It is on the left side most commonly. Lot of these recall questions got repeated. Yesterday also we reviewed that, right? And whenever the intestine passes through these orifices into the thorax, what will happen to the belly? Scaphoid abdomen is characteristic of the hiatal diaphragmatic hernia. Okay, that's very characteristic. Inkoti, because in the fetal life only this will go into the chest, lung will go, atelectasis and agenesis will be typically the feature is what we need to remember. Now, a sagittal section was given, right? Identify the structure. So actually, he has shown the recto-uterine pouch between uterus and rectum. Recto.
That's Douglas. Rectum and uterus.
Pouch of Douglas and recto-uterine. Between rectum and uterine. Between rectum and uterus is the lowest point in the female, where all the pelvic inflammatory disease pus get accumulated. Ectopic pregnancy rupture हुए तो blood get accumulated. The other day I had one patient admitted. Everybody thought it is a severe abdominal pain was there. So everybody thought possible diagnosis as appendix, and that got appendiceal abscess. One old surgeon came. She is the niece of that surgeon. He said, my niece has amenorrhea for past 3 months. I am suspecting possibly it could be ruptured ectopic. If somebody can give me needle, I want to check any blood collection in the pouch of Douglas. Abba, we forgot to take that history, we felt. Immediately we got her imaging done and there is a clear blood. And she's lucky she didn't succumb. Generally, ectopic pregnancy rupture presents like a emergency. But luckily it got contained. So pouch of Douglas, Patha physician, they used to put the needle and then drain out the blood to discover the rupture. The patient is undergoing breast surgery. Structure has been retracted. What is that structure? Serratus anterior has been shown. And the one which was labeled in that image was pectoralis major. Looking at, so this is also common sense in exam. Yeah. Serratus anterior, pectoralis major, minor. Always image-based questions are easiest. So the funda here is you should know serratus anterior typically lies under the pectoralis major in the lateral chest wall, right? Now, doctor, what is the structure given? Blastocyst was shown. So there is a outer cell layer, trophoblastic, inner cell mass was also there, a blastocele, fluid-filled cavity. These are all the classical features of the blastocyst is the stage at which implantation occurs. That's a funda. So it is typically formed on day 5 and 6. It implants into the uterus on day 6 or 7 is what need to be remembered. Right, doc? So first morula, then blastocyst, then gastrula, then neurula. That's how the embryonic development happened. Now a structure was shown which was cystic artery, which is a boundary of Kellogg's triangle. Yesterday we discussed. What is the epiphysis that was marked? It was a pressure epiphysis. This is a favorite topic, doc. There's a list, different types of epiphysis. Where are they located? Homework. Epiphysis. ఇప్పుడు చార్జిపిటీలో కొట్టగానే జుప్పు కని వస్తాయి లిస్ట్. ఎపిఫైసిస్ ఫర్ నీట్ పీజీ గివ్ మీ బజ్వర్డ్ లిస్ట్. సో తొందరగా బతుకమ్మ ఉయ్యాలో చెప్పండి. Pressure epiphysis, head of the femur, lower end of the tibia, humeral head, wherever pressure is born. Traction epiphysis. Typically, whenever there is a muscle attachment like mastoid process, greater and lesser trochanter, tibial tuberosity, they're all examples of traction epiphysis. What is atavistic epiphysis? That was there in monkeys, chimpanzees, and us also. That is coracoid process of the scapula is an example of atavistic epiphysis. So all this list, adi jara koncham batti gotti koncham mala recalling or not, you need to be very sure, right? Now, doctor, a carpenter has a swelling around the knee. It is called housemaid knee. Housemaid knee is pre-patellar or post-patellar? Pre-patellar bursitis. Whereas clergymen will be praying, it is an infra-patellar bursitis is clergyman knee. Pre-patellar bursitis is housemaid's knee. The patient has a blooded urethral meatus. Yesterday we discussed this. Bulbar urethra. Review cheyagaligaara? Bulbar urethra, membranous urethra. Where will be on examination a floating prostate will be found membranous urethra aithe. Dentlo atlane intraperitoneal, extraperitoneal rupture of the bladder. List of differences. Adokati. Yeah, raskuntara homework. తను మొత్తము ఇట్లా టాపిక్లు చెప్తుంటే అన్ని రాసేది మళ్ళీ చదివేది కాదు, అది ప్రాబ్లం. రాయాలి, చదవాలి మళ్ళీ దాన్ని. దట్ इज द पर्पस. 2 घंटे अगर पढ़े तो 10 घंटे आपको इंस्पिरेशन मिलना होमवर्क, देन ओनली आई एम ए टीचर, अदरवाइज आई एम आकाशवाणी. The patient has numbness, tingling, paresthesia along the lateral 3.5 fingers is radial nerve, including the dorsum of the base of the thumb. Ikkada anatomical snuff box area. Andukosam is radial nerve, right? So okasari quick ga raskondi. Ulnar nerve, ulnar, radial, median, axillary, musculocutaneous. ఈ 5 క్వశ్చన్ రాకుంటే చెవి కోసుకుంటున్నాను. రేడియల్, అల్నార్, మీడియన్, no, only this 5. Radial, ask your friends to read other nerves, but 5: radial, ulnar, median, musculocutaneous, axillary, upper and lower brachial plexus palsy. ఒక్కొక్క దాని మీద 10 పాయింట్స్ రెడీగా ఉండాలి. మళ్ళీ ఇవి ఫ్రొమెంట్ సైన్, ఆల్ దీస్ సైన్స్, అందులో 2-3 పాయింట్స్ ఉంటాయి. which muscle is weak, which muscle is compensating in the front sign, what is ulnar paradox, all those funda. మీరు ఏం లే, మీరు 5 nerves ఇచ్చి make me champion.
Ulnar, radial, median, musculocutaneous,
axillary nerve, upper and lower brachial plexus. Next, and compulsory out of 300 questions, 1 question assured from this list, either in orthopedics or in anatomy. wo piche padega. A patient has a numbness over the 4th and 5th digits with a partial claw hand is ulnar nerve. Interossei are all supplied by ulnar nerve. Interossei em chesthe, dorsal interossei dab, pad dab, palmar interossei lead to adduction, dorsal interossei lead to abduction. All interossei are supplied by ulnar nerve. That's the reason ulnar nerve is called musician's nerve. Enter, which is called laborer's nerve. All the coarse movement of your hand, no, they're all median nerve supply. Ante me flexors avanni kuda coarse movements are median nerve. Ulnar, median nerve, correct. So claw hand ainanka, what is the histology slide? Thymus okati malla raskondi, spleen, thymus, tonsil, lymph node, ee naalgitikinu 3 to 4 points on their histological specialties. टिप्स में रहना, डेफिनेटली एक क्वेश्चन आएगा. Presence of lobules, cortex, medulla, Hazel's corpuscles are pathognomonic of thymus. What is a Hazel corpuscle? Circular pink whorl which is present in the medulla is called Hazel's corpuscle. గుర్తుపెట్టుకుంటే థైమస్ లో ఉంటుంది, Hazel's corpuscles ఉంటాయి. What is their function? That is the place where the T lymphocyte undergoes the maturation. What is the maturation? To recognize the self and non-self, अपना और पराये को पहचानने वाले ज्ञान कहाँ मिलता है टी लिम्फोसाइट को? थाइमस में. अगर यहाँ इधर गड़बड़ हो गया तो that lead to autoimmune conditions. Our own cells को मार लेता. Right, doc? Then identify the histology slide. Mala, different cartilage types, where are they located and how do they look like histologically? छट्टू मियाँ को पूछो. छट्टू मियाँ मालूम है? चैट जीपीटी. ఇది అయిపోగానే మీరు అది మీరు ఓపెన్ చేయండి. ఓపెన్ చేసి మొత్తం రెడీ చేసుకోండి. అమ్యునిషన్, జుగల్బందీ టు ఫినిష్.
పొద్దున్న చేస్తా అంటే ఈ రోజు వింబిల్డన్ ఫైనల్స్.
అమ్మా,
మార్నింగ్ నుంచి ఇక్కడనే కూర్చున్నా సార్. నైట్ అయితే అది
చూడాల్సిందేనా? అది చూస్తుందండి. పక్కన కొట్టంగానే అల్లాడినావు, పక్కన కొట్టగానే మీడియం. కానీ ఇప్పుడు మనము వీఆర్ ఇన్ ఏ వార్ స్టేజ్ డాక్టర్.
Refresh for 2 hours.
But the good part is you are sports addict, always sports ఆడేవాళ్ళు. Generally they are expected to have good fighting spirit. Adi more important than anything else in life, no?
Smart work more than hard work.
తనుండే వాడుగా, what is his name? మనకి కౌశిక్, footballer.
But anesthesia is.
Now in the cerebellar, ఒకటి మూడు గుర్తుపెట్టుకున్నాక 3 E's about elastic. Epiglottis, external eustachian tube is elastic cartilage. Okay. Now cerebellar cortex lo you need to identify Purkinje cell. So where is the Purkinje cell located? Mala, this is important. ఇవన్నీ క్వశ్చన్ బ్యాంక్ లో కూర్చున్నాయి. cerebellum layers, cells. Ask Chattubai to give you the list. ఒక 20 points పెట్టుకోండి. ఆ 20 points రెడీగా ఉండి యూ హ్యావ్ టు గో అండ్ అటాక్. వేర్ ఈజ్ మై cerebellar histology? సో మాలిక్యులర్ లేయర్ అండ్ గ్రాన్యులర్ లేయర్ లో Purkinje cell ఉంటాయి. వాట్ ఈస్ ద ఇంపార్టెన్స్ ఆఫ్ Purkinje cell, డాక్టర్? It is the only spokesperson, like Congress party spokesperson. It is the Amit Shah for BJP laga Purkinje cell. It is the only output neuron of the cerebellar cortex. It is GABAergic and inhibitory. And it is located in a single layer between molecular and granular cells is what you need to remember. So what are all the other cells? Molecular layer lo Purkinje cells, basket and stellate cells. Granular layer lo it contain Golgi cells. That's the point. Well, each of these cells ke the untadi story. Then in a patient after giving noradrenaline injection, there is a decrease in heart rate observed. What is this because of? Whenever you give noradrenaline, it's a strong vasoconstrictor. Vasoconstriction lead to increased total peripheral resistance. That will go and stimulate the baroreceptor reflex. Any increased pressure will stimulate vagus. Vagus will lead to bradycardia. So that is the stimulation of the baroreceptors because of the vasoconstriction caused by the noradrenaline, which is acting on alpha-1 receptors. Alpha-1, alpha-2, beta-1, beta-2 story. Gurtundi kada? Alpha-2 ekkada untadi? Brain lo untadi. Alpha-1 blood vessels మీద ఉంటది. Okay, doc? So it stimulates alpha-1 receptors, increase the BP, it stimulates the carotid, that lead to increased vagal tone, which leads to the decreased heart rate, is what you need to remember. Mala raskondri. Alpha-1, alpha-2, beta-1, beta-2, epinephrine, norepinephrine, Chatubhai ko bolo. Give the buzzwords. Itlane approach call exam. Ready ga? What changes occur during muscle contraction when you are exercising? Right, doctor? I band decreases. A band remains same. Right? So first of all, what is A band? మధ్యలో ఉంటుంది myosin filament, thick band, that will remain constant. Then I band will decrease because actin slides over myosin. I band is because of that. Quickly review. The sarcomere bands for need PG or FMGE, whatever you call. ChatGPT will give you the list. What is the mechanism of botulinum toxin? Microbial yes. It inhibits acetylcholine from the presynaptic terminal is what we need to remember. What do they call? Snare proteins. It cleaves the snare complex proteins and prevents vesicle fusion, thus no acetylcholine release. If that is not there, how can muscle contraction can occur? It cannot. Other story. Huh? Then doctor. ADH act on which part of the nephron? Cortical collected duct. Make a note. Different segments of nephron for need PGFMG buzzwords. It will give everything. B2. Where is the sodium potassium 2 chloride channel? B2 receptors. Huh? Is B2 receptors. Very good. And where is sodium potassium 2 chloride channel? Thick. Ascending limb of loop of Henle. Where is the sodium and hydrogen channel? Sodium and hydrogen. Or sodium potassium channel. Sorry. Sodium potassium is distal tubule. Where will thiazide diuretics act? Distal. Where will loop diuretics act? Very good. Very good. Anni kadak. So the diuretics, all diuretics classification mechanism, side effects 2, 3. Compulsory topic in the FMGE. మీకు ఒక 1000 హోంవర్క్లు రెడీ అవుతాయి, టేబుల్స్ రెడీ అవుతాయి పీడిఎస్డే. నేను చెప్తున్నా కదా, మళ్ళీ జేవిపి లేకుండా పేపర్ ఉండదు. జేవిపి, ఇఫ్ జేవిపి క్వశ్చన్ ఈస్ నాట్ దేర్, మై ఖాన్ కట్ కరుంగా, మురళీ ఖాన్. Right? Good. Good to see 3 online classmates. And can you please punch his voice loud and clear, doctor? What is this? Finally?
Got FMGE teacher to clear doubts in Telugu. Finally got an FMGE teacher to clear doubts in Telugu.
Acha, हम तो तेलुगु मीडियम है भाई. I was there in Telugu medium up to 12th. First year MBBS में all my classmate girls are beyond my reach. So A wave corresponds to right atrial contraction. I think this is the easiest ever asked question on JVP. Yeah. So all JVP nana.
Yeah.
Canon A waves అన్ని ఉన్నాయి మీ దగ్గర. నేను ఇదివరకు ఇచ్చిన మళ్ళీ మీరు ఫ్రెష్ గా చేసుకోండి. చేసుకుని నువ్వు క్విజ్ చేయి. Absent X descent, absent Y descent, what will happen in constitutive pericarditis, cardiac tamponade, everything.
Yeah.
You must be ready.
Okay.
It's beyond my scope. मैं तो घोड़े को ले जा सकता हूँ, मगर पानी पिलाना बहुत मुश्किल है. Your job, Mithuna. కొంచెము inspire.
Mutual.
Ma'am asked to conspire you actually, but I said I can't. I can only inspire. My 10th class kid 10th class kid only, don't listen. If he feels to listen, he will listen. But you're much better, Viraj, don't worry. Huh? In spite of Wimbledon, you're here. Huh? Means the world is evolving. AI is taking over. So that's the point. So remember,
Repeat question.
dentate, emboliform, globose, fastigial. These four cerebellar nuclei. Huh? And these nuclei receive the inhibitory GABAergic input from the Purkinje cells. Purkinje is the only output of cerebellum. Adi. Bicarbonate exchanged for the chloride ions in the RBC is called chloride. Bicarbonate is HCO3 minus. Chloride is Cl minus. So bicarbonate is exchanged for the chloride ion in the RBC is called the chloride shift. It is also called hamburger phenomena. When will it occur, doctor? So fundamentally, there is an exchange of bicarb out of the RBC and chloride into the RBC. Right? Typically, it happens in the systemic capillaries. Mein kya hota? Carbon dioxide pickup, oxygen drop. Lungs lo carbon dioxide drop, oxygen pickup. Right? So carbonic anhydrase converts CO2 plus H2O into H2CO3 is what we need to remember. Right? Chloride shift. Haldane effect. Ingoti raskondi. Homework. Haldane effect. Chattu bhai ko pucho. ChatGPT ko. Haldane effect. Chloride shift. Give me 5 points. Abba. Oxygen dissociation curve. ఇది ఇంకొక స్టాండర్డ్ గవర్నమెంట్ స్టాంపు. Shift right, shift left. Mainly you need to know which will increase oxygen affinity. Shifting to the right promotes the oxygen unloading. Right? So cadet face right. Cadet is CO2, acidity, 2,3 dpg, exercise and temperature. They will all make
Shift the curve.
Right.
shift right and unload the oxygen. Right? So more easier to remember is what you know. Unloading is right. Possessing that is oxygen मेरा है मैं नहीं देता हूँ अब्बा को किसी को. What is that called? Left shift. Right? So 2,3 dpg, what will it tell? 2,3 dpg, oxygen, hemoglobin is like pati, patni or O. If hemoglobin has a choice, either he loves oxygen, his official wife, or he is okay with the secretary. If 2,3 dpg binds oxygen, leaves my ke chali jaungi and చెప్పి వెళ్ళిపోతుంది and oxygen get delivered. Right? So fetal hemoglobin should bind with oxygen or should have low affinity with oxygen? Should bind because fetus lungs are not working. No, all oxygen is what amma will give the oxygen. So that is the reason fetal hemoglobin by nature doesn't bind at all with 2,3 dpg. So that is the reason low 2,3 dpg means if 2,3 dpg is low, then it will have
More
high affinity for oxygen. Clear, doctor? Then that time it is not unloading, it is possessing. That's the reason it will shift to left. Atlane hypocarbia. Hypercarbia means
more
high CO2, low oxygen state. Hypocarbia means
low CO2, high oxygen.
high oxygen. Already if high oxygen is there, it need not unload the oxygen. That's the reason shift it to left. Adi atla gurtu pettukondi. But one question oxygen dissociation curve reserved in FMGE is what you need to basically remember, doctor. Right? It is the same situation even for NEET PG, doctor. No different. Right?
Sir, from where can we download PDF?
PDF already is posted in the group, no? ISKA. Other PDFs I'll send. What is the mechanism of action of botulinum toxin? Same. I think this is repeated. Then ADH axon, cortical collecting duct. Once more repeat. A renal biopsy was shown. And the cells are marked are extraglomerular mesangial cell. నేను చెప్పిన నెఫ్రాన్ ఫిజియాలజీ అడిగిండా, నెఫ్రాన్ హిస్టాలజీ కూడా అడిగిండు. అంటే నెఫ్రాన్ కూర్చున్నదాడ. So if a question is asked about proximal convoluted tubule में कितना water reabsorption होगा, glucose, amino acids, where are they reabsorbed? If you can't answer, your friends will answer and move forward on your cadaver. So extraglomerular mesangial cells, right? So there is a part called juxtaglomerular apparatus. It has got macula densa, juxtaglomerular cells and lacy cells.
Near the efferent.
Huh?
Near the efferent.
Afferent arteriole, efferent arteriole ఉంటుందా?
Efferent.
ఈ రెండు ప్లస్ డిస్టల్ కన్వల్యూటెడ్ ట్యూబ్యూల్, ఈ మూడు కాన్ఫ్లుయెన్స్ పాయింట్ ఈస్ జేజీ juxtaglomerular apparatus. ఏమేంటి? afferent arteriole, efferent arteriole and distal convoluted tubule.
Yes, sir. Image low. One question was asked: is it near the afferent or is it near the efferent?
Arteriole.
Near the efferent. Yeah. Juxtaglomerular apparatus is near the efferent.
Okay.
బయటికి వచ్చే దగ్గర ఇది ఉంటుంది సార్. అది లేబులింగ్ ఇచ్చి ఇన్ని సెట్ వచ్చినట్టు.
But macula densa are fundamentally the specialized cells of distal convoluted tubule. So macula densa ఏం చేస్తుంది? ఈ ప్రాక్సిమల్ కన్వల్యూటెడ్ ట్యూబ్యూల్ లోకి గ్లామెరులర్ ఫిల్ట్రేట్ రాగానే ఇప్పుడు ఇట్లా బ్లడ్ వెజల్స్ ఉంటాయి, దాని చుట్టూ బౌమెన్స్ క్యాప్సూల్ ఉంటుంది, దాంట్లో వచ్చి ప్రాక్సిమల్ కన్వల్యూటెడ్ ట్యూబ్యూల్లోకి ట్యూబులర్ ఫ్లూయిడ్ వస్తుంది, యూరిన్ రాగానే దాంట్లో NaCl లెవెల్స్ చూసుకుంటుంది, సెన్స్ చేస్తుంది. సపోజ్ అది NaCl లెవెల్స్ కనుక లో ఉన్నాయనుకోండి, దెన్ అదేమంటది, ఇట్ విల్ రిలీజ్ రెనిన్, angiotensin, aldosterone, that will go and retain the sodium ions. ఎందుకు? ఈ ఫ్లూయిడ్ లా సోడియం తక్కువ ఉంది అనుకోండి, యూ కాంట్ అఫోర్డ్ టు లూజ్ ఇట్. దట్స్ రీజన్ వాట్ ఇట్ విల్ డూ, ఇట్ విల్ రిటైన్. హూ షుడ్ సెన్స్ దట్? Macula densa. When the fluid formed in the proximal convoluted tubule is passing closer to macula densa, it will sense that, oh, sodium is low, then it produces renin, angiotensin, aldosterone, and that will lead to sodium retention by the time fluid reaches the collecting duct, where sodium will act. Aldosterone will act. Okay? Gurtupettukuntara? Dehydration is more severe in the infants compared to adults. What is the reason? Because ECF is more than the ICF in case of children. Mali raskondi. What is the reverse engineering of the question paper by the examiner? ECF, ICF, plasma volume, percentages, what are the principal cations, anions in them? Ivanni kuda, they're all the masala issues for the examiner. Chettu bhai ko pucho, ECF, ICF, TBW, FMGE, NEET PG, buzzwords, de do. And again, he knows how to. Now it's a 4.5 version of ChatGPT has become it is the only national faculty, dream team. So students need not run behind, where can I get notes and all that. Buy a $10 ChatGPT. Group link, okay. Give a call to 9000868356. She will help you to get the PDF, etc., etc. Now, doctor. A hypertensive patient's lab result reveals hypernatremia, hypokalemia, metabolic alkalosis. What is the most probable diagnosis? So, hypernatremia, sodium retained, hypokalemia, potassium lost, metabolic alkalosis, H+ lost into urine, all because of excess aldosterone. So hyperaldosteronism is called Conn syndrome. Beautiful. Conn syndrome. Mala anna raskondi. Barter's Gitelman Little Conn. Barter Gitelman
Fanconi.
Fanconi is in a different line. That Fanconi is also important, but there is a proximal convoluted tubule dysfunction leading to amino aciduria and glycosuria. Even related.
Yes.
Barter, Little, Gitelman, Conn's, Gordon syndrome.
Yes.
ఈ ఐదిట్ల దేంట్లో వేర్ విల్ యూ హ్యావ్ హైపర్ టెన్షన్, వేర్ విల్ యూ నాట్ హ్యావ్ మెగ్నీసీమియా గుర్తుందా? మనం అప్పుడు చదివినాం
Yeah.
ఎప్పుడో బ్రిటిష్ రాజ్ లెఫ్ట్ విరాజ్ స్టడీడ్. అది మళ్ళీ చదవాలి
Little is
అంటే అడుగుతాడు. ఇప్పుడు వీడు ఇది అడిగిందంటే అది అడగడా?
Yeah.
అడుగుతాడు. అడుగుతాడని తెలిసి కూడా చదవకపోతే దట్ ఈస్ అన్యాక్సెప్టబుల్. Barter Gitelman. Barter is the NKCC2 mutation in the loop of Henle. Barter is like loop diuretics. Gitelman is like thiazide diuretics, is what you need to remember. And there is a magnesiuria, calciuria in case of Gitelman. Right? Magnesiuria, calciuria in Gitelman. Differences. ఒక్కసారి ఆ టేబుల్ చెట్టు పైకి కూర్చో, ఓ కర్లిత కామ్. Then during spermatogenesis, which hormone inhibits the FSH inhibin? The name itself says inhibin and inhibin A, B రెండు ఉంటాయి. Inhibin is secreted by whom? Sertoli cells. It selectively inhibits FSH from anterior pituitary. And FSH
A is inhibitory for FSH, inhibin A, but whereas inhibin B triggers the pituitary to produce FSH.
oh అట్లనా? ఒకసారి మళ్ళీ కౌంటర్ చెక్ చేయండి, ఎందుకంటే కౌంటర్ చెక్ చేయాలి. ఇన్హిబిన్ ఏ అండి నాకు తెలియదు మరి.
మొన్ననే సార్
అవునా? ఓకే, రీచెక్ చేయండి ఒకసారి. ఓన్లీ ఐఎమ్ అథారిటీ. సో గుడ్. నో, మిథున is also good authority. No doubt on it. I mean, seniority wise, we need respect seniority, right? ఈసారి కొట్టాలే నువ్వు. You have to finish at any cost. All motivation, Dr. Saab, motivation, we need to be said. For that, first thing we should do is forming a gang. Gang ఉన్నాం అనుకోండి, ఒక 4-5 ఉండాలి గ్యాంగ్. కరెక్ట్. నాకు మొన్నటి దాకా స్ట్రైక్ కాలే అంటల్ మమ్మీ టోల్డ్ కాల్ సంబడి అని అంటే, అప్పుడు దెన్ ఐ అండర్స్టూడ్, అరే మిస్డ్ అని. Now, which hormone is involved in this reflex? Oxytocin. Actually, which reflex it was? Milk letting.
ejection.
Prolactin is for production. Oxytocin is for ejection. A patient has a difficulty in switching from one movement to other is dysdiadochokinesia. Mala idi raskondi. Tremors. Tremors. Different type. Resting tremor, intention tremor. You will have in asterisk cystular tremor. Parkinsonism tremor is asymmetrical tremor, pill rolling. Flapping tremor in case of the hepatic encephalopathy. Intention tremor in cerebellar dysfunction. That means only in the beginning of movement and the end of the movement. Mukku patko Ramaya. Like this. That is intention tremor. Right? Then the developmental of cataracts in patients with diabetes is due to sorbitol. All that excess glucose become aldose reductase, convert into sorbitol, and that is osmotically active. A patient presents with gum bleeding, petechiae, poor wound healing is vitamin C, scurvy. Or ask 20. Compulsory topic apa. Vitamins lekunda vitamins oti vaccines okati paper out.
This is an SPM.
తప్పు చేసినాం అంటే
Oh, really? Oh, this comes under SPM.
అన్ని బయోకెమిస్ట్రీ, ఎస్పిఎం, మెడిసిన్, ఎవ్రీవేర్ విటమిన్స్ ఆర్ దేర్. దెర్ ఇస్ నో క్వశ్చన్ పేపర్ ఇన్, బట్ ఐ విల్ గివ్ యూ లాస్ట్ 10 years క్వశ్చన్ పేపర్స్.
So I have one doubt. Diabetic retinopathy, which fibers are spared and which fibers are involved? మీరు ఇంతకు ముందు చెప్పారు.
ఇక్కడ రెటినోపతి న్యూరోపతి
Retinopathy. One is spared and one is involved.
ఒకసారి విల్ చెక్. సో అది చూడండి డాక్టర్, ఆస్ చెట్టుపై ఆల్ ఎంజైమ్స్, విటమిన్స్ అండ్ స్పెసిఫిక్ పాయింట్స్ ఫర్ FMGE నీట్ పీజీ. మనం ఇట్లా రెడీగా ఉండాలి. ఎగ్జామ్కి వెళ్ళినప్పుడు ఎగ్జామ్కి వెళ్ళి వేర్ ఇస్ ద విటమిన్ క్వశ్చన్, అమ్మ దొరికింది. నెఫ్రాన్ ఫిజియాలజీ దొరికింది, గ్లామరల్ నెఫ్రైటిస్ దొరికింది, ఓసిపి దొరికింది, కార్సినోమన్ దొరికింది, ఎండోమెట్రియల్ క్యాన్సర్ దొరికింది. ఏమున్నది తెలియదు, ఏమున్నది. తర్వాత ప్రధాన మంత్రి స్వచ్ఛ భారత్ సమాన్, అమ్మో ఇది ఎట్లా రాదనుకున్నాము, రాదు, ఎందుకంటే మనం వదిలేసినాం కదా. అట్లే మస్కిటో ఇలా కూర్చుని ఎక్స్ రిలీజ్ చేస్తే అదేం మస్కిటో, ఎనాఫిలస్సా, డెంగ్యూనా, ఏంటి ఎయిడిసా ఏంటి అని అంటే ఆల్రెడీ మస్కిటో కలర్లు అవి చదువుదాం అనుకున్నాం, చదవలేదు, అవి వస్తుంది. అట్లనే ఎల్లో బ్యాగ్, రెడ్ బ్యాగ్, బ్లూ బ్యాగ్, బయోమెడికల్ వేస్ట్ డిస్పోజల్ వస్తుంది. Keep the things ready as ammunition. Cataract, sure. Glaucoma, sure. That's how we passed MBBS, knowing 2 topics. Now, what is essential pentossuria? L-xylulose. It is an autosomal recessive disorder where L-xylulose is excreted and the enzyme is L-xylulose reductase is the one which is deficient. Mala last one. Essential fructosuria and fructose intolerance. Compulsory. Galactosemia, different types. Galt deficiency versus another type, galactokinase deficiency. ఈ రెండిట్లో ఏది బినైన్, ఏది మెలిగ్నెంట్, కంపల్సరీ. దెన్ డాక్టర్, 2-year-old with bow legs, normal calcium, high PTH. Bow legs, normal calcium, but high PTH is rickets. Once there is a rickets, there is a vitamin D deficiency. Vitamin D deficiency lead to hypocalcemia. Hypocalcemia will stimulate the PTH release, secondary hyperparathyroidism occur, and all that excess PTH will go and resorb the bone and release the calcium, so that low calcium become normal calcium. So kabatti normal calcium with a high PTH with the bow legs is equal to rickets. Mala raskondi, primary hyperparathyroidism, secondary hyperparathyroidism, tertiary hyperparathyroidism, మళ్ళీ అది హైపర్. దీంట్లో ఇదొకటి గుర్తుపెట్టుకోండి, ఇది చెట్టుపైకి కూర్చో ఆర్ రాసుకున్నారా. నెక్స్ట్ సూడో హైపోపారాథైరాయిడిజం, హైపోపారాథైరాయిడిజం, సూడో హైపోపారాథైరాయిడిజం, షూర్. ఇవన్నీ రాసింది ఇట్లా, చదివేది కాదు. ఏం చేస్తాం చెప్పండి, పిల్లలు మాట వింటలేరు. I am becoming old. So, low phosphate. Why low phosphate? When there is a vitamin D deficiency, right? Hypocalcemia occur first. ఎందుకంటే విటమిన్ డి లేకుంటే కాల్షియం అబ్జార్ప్షన్ కాదు. Hypocalcemia stimulates secondary hyperparathyroidism. But parathyroid effect ఏంటి on kidney? It causes calcium reabsorption, but phosphate loss into urine. Because of that phosphaturia caused by the hyperparathyroidism, there is a low phosphate level. So normal calcium, low phosphate, high alkaline phosphate, high PTH is equal to vitamin D. Rickets. Good. Very good. A 4-day-old neonate presents with bilirubin of 15. What is the diagnosis? Always?
24.
Very good. After 24 hours, peaks by day 3 to 5, resolves by day 10 to 14. Bilirubin is usually less than 17. Right? And physiological jaundice is unconjugated bilirubin, because that babies will have immature UGT T1A1. Thank God. That's how pediatricians survive. Pediatrics అయితే మెయిన్ బ్రెడ్ అండ్ బటర్ ఏంటి? బేబీ పుట్టంగానే ఫిజియలాజికల్ జాండీస్ వచ్చి, అమ్మో మేరే బేబీకో 20 ఆ గయా అంటారు. దిల్ పుట్ 20,000 rupees ఆ గయా. సో అట్లా ట్రిగ్లనాథుల్లో టైప్ 1 ఏంటండి? Complete absence of glucuronide transferase. Type 2, some enzyme activity is there. Phenobarbital to age respond aitadi? Type 2. ఎందుకంటే దాంట్లో partial deficiency. Complete deficiency type 1 ఉన్న దాన్ని ఏం ఇంప్రూవ్ చేయలేము మనం. Right? Piggy liver is found in Dubin Johnson. Right? Between Krigler-Nasser, Gilbert, Roter and Dubin Johnson, which is conjugated? ఈ రెండు అన్కాంజుగేటెడ్. అంతేగా దీంట్లో గ్లూకనాల్ ట్రాన్స్ఫర్స్ లేదు. గిల్బర్ట్ ఈజ్ వాట్? స్టార్వేషన్, ఫీవర్ అయిన తర్వాత ఐసోలేటెడ్ హైపర్ బిలిరుబినిమియా, అంటే లివర్ ఎంజైమ్స్ ఆర్ నార్మల్ బట్ ఓన్లీ బిలిరుబిన్ ఈస్ ఎలివేటెడ్. దట్ ఈస్ గిల్బర్ట్. ఓకే. One difference between Viraj and Kaushik is all anxiety. He zero anxiety. I really didn't see anyone who is so stable. That is actually a very important clinical parameter needed to become topper. Remember that. If your mind is engaged in bothering, how will it execute? కదా అవునా? సో అది మోస్ట్ ఇంపార్టెంట్, విచ్ విల్ హెల్ప్ యూ. आप हाइबत नहीं होगा. वो last time the gang all half time you are only feeling tension. So this is the story. Day 3 baby is LOC 3C whatever, some stupid way. Now during starvation, which hormone is produced to maintain the glucose level? When you eat more, you have more insulin. When you starve more, you have more glucagon. Right? So glucagon, epinephrine, growth hormone, all the three one party. And insulin one party. గుర్తుపెట్టుకోండి. అందుకోసం మనం స్టిరాయిడ్స్ ఇచ్చారనుకోండి, స్టిరాయిడ్స్ కూడా, స్టిరాయిడ్స్, గ్రోత్ హార్మోన్, గ్లూకాగాన్, ఎపినెఫ్రిన్. మళ్ళీ చెప్పండి. స్టిరాయిడ్, గ్లూకాగాన్, గ్రోత్ హార్మోన్, ఎపినెఫ్రిన్, ఇవన్నీ ఒక పార్టీ. దే విల్ ఆల్ లీడ్ టు హైపర్గ్లైసీమియా. దే ఆల్ లీడ్ టు ఇన్సులిన్ ఇంటాలరెన్స్. ఆపోజిట్ టు ఇన్సులిన్. ఇన్సులిన్ ఇంటాలరెన్స్. ఇన్సులిన్ ఒక ఎత్తు అయితే ఇవన్నీ. అందుకోసం స్టిరాయిడ్ ఇంజెక్షన్ ఇవ్వగానే పేషెంట్స్ విల్ బికమ్ డయాబెటిక్. ఓకే. నౌ డాక్టర్, patient has arthritis and arthroscopy show blackening of the joint అనగానే ఆల్కప్టెన్యూరియా. మీరు మళ్ళీ ఇంకొకటి రాసుకోండి. ఫీడింగ్ స్టార్వేషన్ సైకిల్ బయోకెమికల్ చేంजेस और फीडिंग स्टार्वेशन फॉर नीट पीजी एफएमजी बोलो, चट्टू भाई समझ लेगा और सर्विस कर लेगा. ठीक है. हाँ. A patient has arthritis and arthroscopy show blackening is called ochronosis. Ochronosis is typically because of alkaptonuria, which is caused by the deficiency of homogentisate oxidase with the accumulation of homogentisic acid is what you need to remember. First raskondi. Alkaptonuria, phenylketonuria and porphyria. ఇది లేకుండా పేపర్ ఉండదప్ప. పార్ఫైరియాలు అన్ని దిక్కులేని ఎంజైమ్లు, వాట్ ఈస్ దేర్ ఇన్హెరిటెన్స్ ప్యాటర్న్లు. Then lipoproteins. One question, compulsory lipoprotein. Everything, anything, 20 points must be ready. Next, hypolipidemic drugs. Malla 20 points ready. Hyperlipoproteinemias. Malla what inheritance pattern? Where do you find xanthomas? Where do you find arcus generalis? Where will the blood become cheesy, colored? Compulsory. Chettu bhai ko table dene ke liye bolo. हाँ. Nowadays, I'm not teaching. I'm only deciding what you should read. Mala idi raskondi. Gotcha, Niemann-Pick, etc. Gurtukostలేదు. తర్వాత హంటర్, హర్లర్, etc. మ్యూకోపాలిసాకరిడోసిస్, హంటర్, హర్లర్, అవన్నీ. క్రంపుల్డ్ టిష్యూ పేపర్ అపియరెన్స్ ఇన్ గాచెట్స్ డిసీజ్, అది అడిగి చచ్చిండాడు. తర్వాత నీమన్ పిక్ లో గాచర్ లో దేంట్లో హెపటోస్పెలమెగలీ ఉంటుంది, దేంట్లో ఉండదు, మళ్ళీ అదొక ఇష్యూ. హంటర్ హర్లర్ లో ఎవరికి కార్నియల్ క్లౌడింగ్ ఉంటుంది, మార్కియోస్ లో శాన్ ఫిలిప్పోస్ డిసీజ్ లో వాట్ ఈస్ ద ఎంజైమ్ డెఫిషియెంట్, చట్టు బైక పూచో చాట్ జీపీటీ దే దేగా ఆప్కో టేబుల్. తర్వాత గ్లైకోజన్ స్టోరేజ్ డిజార్డర్స్, వాన్ గైర్క్, మెకాడిల్స్, ఆ ఎంజైమ్, ఆ లిస్ట్ ఒకటి తప్ప, రైట్? సో టిపికలీ అమ్మో వీడు ఏమడిగాడు, నటోవిక్స్ డిసీజ్ అట, నాకు తెలియదు. అంటే దిస్ కైండ్ ఆఫ్ క్వశ్చన్స్ వెన్ దే కమ్, నో, the Persian rug makers purposefully leave one small hole in the beautifully woven rug. You know, somebody asked why.
Yeah.
If we don't leave hole, we are trying to tell that we are perfect. No, only Lord Allah is perfect. To mark to subserve before the authority of the Almighty Allah, they leave a hole in the rug. So that's the reason whenever we go to the entrance exam, no, we should pray, God give me the strength to recall the things that I can from my preparation and accept the things that I never heard. Especially negative marking exam. Don't try to run with salivation for everything that I know. Once you enter into that, you will enter into world of Maya. I know this. Yes. Somewhere I read, yaar. Feeling aate rehta. For FMGE is okay. Anne seal pettukuntu poyina pass itu.
It's not a negative one. There's no negative.
No.
No negative marking.
Yeah.
Already he is scoring 56%, 54. నా భయం ఏంటంటే కనీసం 65 వస్తే,
Yeah. లాస్ట్ 4 టెస్ట్స్ ఇక్కడనే ఉండే
ఆ?
సార్. అదే లాస్ట్ 4 టెస్ట్స్ ఇక్కడనే ఉండే 52 to 56.
That's
So
good.
yeah.
ఇప్పుడు నౌ అవర్ గోల్ ఈస్ డైలీ 1% పెంచుకుంటూ పోవాలి. 10% పెంచి 64కి వెళ్తే 50 వస్తుంది అని హోప్.
That's self-reported.
Now, which amino acid primarily acts as a buffer in the blood? Histidine, because the pKa value of the histidine is closer to the pH value of the plasma. pKa అంటే ఏంటి? Every amino acid exists as a positive and negative state, and between the two it exists in a amphibolic state, that is equal amount of plus and minus. So histidine's pKa value, that is the pH at which it exists as a neutral ion, is closer to the pH of the plasma. Hence, it acts like a buffer at physiological pH. Why histidine has a imidazole side chain? Imidazole side chain. Mala raskondi. Amino acids for NEET PG FMGE. What are essential amino acid? PV Hilt mark, proline, valine, histidine, isoleucine, leucine, tryptophan, atla మొత్తం ఉన్నాయి. PV Hilt malt. M అంటే మెథియోనిన్, A అంటే ఆర్జినిన్, ఇంకోటి ఏదో ఉంది, ఒకసారి చూడండి. PV Hilt malt. అట్లనే వాటర్,
చాలా వచ్చినాయి సార్, అన్ని గెస్ పెడితే.
అరే అవే అడుగుతాడు వాడు. ఏం లేదు, 3 టేబుల్స్. వాట్ ఆర్ ది పోలార్, నాన్ పోలార్ అమైనో యాసిడ్ లిస్ట్, వాట్ ఆర్ గ్లూకోజెనిక్, కిటోజెనిక్ అండ్ బోత్, అదొక లిస్ట్. ఆ తర్వాత ప్రతి అమైనో యాసిడ్ షార్టెస్ట్, స్మాలెస్ట్ అమైనో యాసిడ్ గ్లైసిన్, విచ్ విల్ బి ప్రెసెంట్ ఇన్ వేరెవర్ ది
Corners.
whenever the protein is taking a turn, a turning point దగ్గర glycine ఉంటుంది. తర్వాత proline is that one which is there in collagen. It is the hydroxylation of the proline that gives the collagen strength. And a hydroxylation ఎందుకు ఎవరు చేస్తారు? విటమిన్ సి. Vitamin C is the coenzyme for hydroxylation. No vitamin C, no hydroxylation of protein, collagen is not strong. That's the reason the capillaries will become fragile in their wall and they undergo bleeding. That's the reason in the scurvy we get the gum bleeding and all. But in the scurvy, how is the platelet count? Platelet count is normal. Adi.
So 2 minute break. Please.
Oh yeah, please. Ayo, no way. So what we need to do is, we need to freeze very high yield tables. Laser focus on that. No, nothing non-specific.
Okay.
Hmm?
So just one mock test and rest day.
One mock test.
Per day, ఇంకా rest of the day.
Rest of the day అంతా కూడా నేను ఒక 200 tables ఐ ప్రెసిపిటేట్. ఆ 200 tables రెడీ చేసుకుని జీపీటీలో you have a mutual review and quizzing. How to remember?
Divide the day into 3 parts.
Hmm.
First part will be some subject revision.
Hmm.
Second part will be whatever sir is given highly into
Yeah.
device schedule. The last part will be your mock test.
No. He has taken mock test. One part is mock test. One part is whatever I precipitate.
That's a separate.
అది రివిజన్, అవి ప్రిపేర్ చేసుకుని రివిజన్. అదర్ పార్ట్ విల్ బి ఐ విల్ బి ఆక్యుపైయింగ్ టు టీచ్. అది దట్స్ ద గోల్. వాళ్ళకి 300 క్వశ్చన్ మాక్ టెస్ట్ ఇట్ సెల్ఫ్ విల్ టేక్ అబౌట్ 3 hours టు ఆన్సర్, 1 hour టు.
అట్లా వీళ్ళు they're not letting you skip sections, sir. ఒక సెక్షన్ స్టార్ట్ చేస్తే 50 minutes అవ్వగానే నెక్స్ట్ సెక్షన్ కి
Yeah, you
వెళ్తారు.
can't.
యాక్చువల్ ఎగ్జామ్ ఇస్ ఆల్సో లైక్ దట్.
Yeah, so అంటే
It's
even if
everywhere.
Oh, okay.
He said everywhere.
oh no
But the
because
problem is negative marks.
yeah.
So that's good. If we are like that for the next 12 days strategically, and you precipitate all the topics that I gave, you ask for all the points for the NEET PG FMGE in the buzzword style. It will give the list. ఆ లిస్ట్ పట్టుకుని రివ్యూ యూనిట్ 2. Okay, another half an hour.
Oh yeah, anything.
Okay.
When does the
A patient with the history of strenuous exercise, skipped a meal, and later consumed alcohol. Alcohol inhibits which biochemical process that lead to hypoglycemia? Alcohol inhibits gluconeogenesis. What happens in gluconeogenesis? Alcohol is converted into acetaldehyde. Acetaldehyde is converted into acetyl. Acetyl when it passes through citric acid cycle will release NADH. So that is the reason alcohol become the source for NADH. Once NADH is high, the body will sense, oh, maybe this guy has a lot of energy, I don't need to produce glucose, create glucose.
Yeah.
But actually he's not eating. Whenever we are not eating, while consuming, generally people who consume alcohol don't eat.
Yeah.
They eat chips, more alcohol. That will cause stop of, eat. Of course, there are few people who will, both hands will be working. So alcohol become converted by the action of the alcohol dehydrogenase into acetaldehyde, which become acetate, which will enter citric acid cycle, produce the NADH, and the high NADH will inhibit the gluconeogenesis, is what we need to remember. Okay, doc? Alcohol attacks oxaloacetate converting into malate. So gluconeogenesis रास्कोंडी उनके hit list में है. Gluconeogenesis, Chettubai will give 20 points on them. What are the rate limiting enzymes? What are the glucogenic amino acids? What are the energy consumed? All the things. Atlane glycolysis. Compulsory question will come, glycolysis. Gluconeogenesis, glycolysis, pentose phosphate pathway, తర్వాత glycogen breakdown, glycogen synthesis, ఇది కంపల్సరీ. సిట్రిక్ యాసిడ్ సైకిల్, మళ్ళీ ఎనర్జీ ఈల్డ్ పర్ గ్లూకోజ్ if it stops at the level of the pyruvate, or if it continues the citric acid cycle, what are the things? Inkoti, electron transport chain inhibitors is a favorite topic. Electron transfer, ETC inhibitors. Which enzyme is dependent on vitamin C? Chusindra? Vitamin మీద ఎన్ని క్వశ్చన్లు వచ్చినాయో? రెండా మూడా? 2. Vitamin C, prolyl hydroxylase. All hydroxylases are.
I remember this. With proline and
అదే చేస్తుంది, ప్రొలీనే చేస్తుంది.
connected.
Right. Vitamin C is the cofactor for hydroxylase of proline in collagen synthesis, is what we need to basically remember. Then lysyl oxidase, it requires copper. Trace elements is a favorite question of the examiner. Trace elements, molybdenum, manganese, zinc, selenium. Selenium deficiency lead to Cashon's cardiomyopathy. Selenium deficiency. Then, which enzyme is typically elevated in prostate cancer? Acid phosphatase is the one which is used to follow up the therapy. So once more, Raskondi. Tumor markers is the favorite topic. All the list of tumor markers, you should be ready. Then acrodermatitis enteropathica. Whenever there is a zinc deficiency, two questions, a trace element question. मेरी ये एग्जाम को है ना नीट FMGE ला एक ट्रेस एलिमेंट 2 विटामिन A डाल देते लिस्ट मारवाड़ी सेट राजू 4 बिस्किट पैकेट और एक जिंक डाले क्या? जिंक. ग्लाइकोलाइसिस डाले क्या? डाले. लिस्ट विल बी रेडी. అరే ఏంటి జింక్ వచ్చిందమ్మా? సమ్ క్వశ్చన్ ఆన్ జింక్ అండ్ జింక్ లేకుంటే కాల్షియం, వాట్ ఇస్ దట్? ఇఫ్ ఎ స్టూడెంట్ కమ్స్ అవుట్ అండ్ టాక్ లైక్ దట్, నో, దే ఆర్ టూ ఎర్లీ ఫర్ దిస్ అండ్ టూ లేట్ ఫర్ దిస్ అండ్ టూ ఎర్లీ ఫర్ నెక్స్ట్ ఎగ్జామ్. అట్లా జింక్ డెఫిషియన్సీ. ఈసీజీ మొత్తం 15 ఈసీజీస్ నేను మీకు పంపిస్తాను. 15 క్యారెక్టరిస్టిక్ ఈసీజీస్ చూడంగానే యూ షుడ్ స్మెల్ ఇట్ అండ్ ఆన్సర్. So that is the zinc deficiency lead to what? Acrodermatitis enteropathica, perioral rash, perianal rash, history of diarrhea. That is the zinc deficiency. A chronic alcoholic patient decreased food intake for past couple of months and now presents with hypoglycemia. So decreased gluconeogenesis, OAA, alcohol attacks. Repeat. And then 2 times only. What recall question leave? Recall. Which enzyme is responsible for the removal of triglycerides from chylomicron? Lipoproteins. Anna, yeah. Lipoprotein like apoprotein. Lipoprotein ki apoprotein untadi. What is the predominant carrier of the endogenous triglycerides? VLDL. Exogenous triglycerides. Very good. Cholesterol carrier to tissues, LDL. Cholesterol scavenger, HDL. Mala include enzymes and everything. Mala lipoprotein lipases are of 3 kinds. Hormone sensitive lipoprotein lipase, hepatic lipoprotein lipase, endothelial lipoprotein lipase. Mala we mugudiki difference enti raskodi. Lipoprotein lipases types. Chettu bhai dekh lega. And చూడండి, LCAT activity, lecithin cholesterol acyl transferase activity will be there only for HDL. That's the reason it will help in esterifying the cholesterol in the peripheral tissue and bringing and depositing in the liver. That's the reason it works for the scavenger, is what you need to remember. Which is the best marker of apoptosis? Askandi. Apoptosis. Chettubai ko pucho 20 point देना apoptosis के बारे में. नीट PG FMGE के लिए. Apoptosis में you have extrinsic pathway, intrinsic pathway. You have Bax gene, bad gene, pro-apoptotic and anti-apoptotic factors. Sure, short question, Dr. Saab. It is the phosphatidyl serine, which is located on the inner leaflet of the plasma membrane. It will flip to the outer leaflet, and that signals that ये बुद्धि हो गई, वो मर जाने का टाइम आ गया. अनि अनंगने apoptotic enzymes release అయితే खत्म उसका राम राम सत्य है
Factor 5.
यदि
Apoptosis.
apoptosis
Factor 5 is already certain.
అదే confabulation is
Annexin.
annexin 5 binding. Annexin 5 binds to exposed phosphatidylserine. See, once a cell is bound to ఏది మన ఏమంటారు is bound to
Mucilage.
uh,
Bound to die.
bound to die. If it is bound to die, then phosphatidylserine will flip from inner to outer, and annexin 5 will bind to this one, and that this annexin 5 binding is also used to in the flow cytometry detection in vitro for identifying. సో అదన్నట్టు కొంచెం చూడండి అపాప్టోసిస్ గట్టిగా చదవాలి ఒక క్వశ్చన్ లేకుండా పేపర్ లేదు రైట్ అండ్ వాట్ టెస్ట్ షుడ్ బి డన్ ఇన్ సపోజ్ వీఆర్ గోయింగ్ టు బ్యాంకాక్ ఫర్ వెకేషన్ వాట్ వీ విల్ డూ వేర్ డూ వి గెట్ మసాజ్ వేర్ డూ వి సీ ద రివర్ బ్యాంకాక్ రివర్ వాట్ ఆర్ ద ల్యాండ్ మార్క్స్ ఇన్ బ్యాంకాక్ ఇట్లా ఒక లిస్ట్ తయారు చేసుకుంటారు కదా ఇది కూడా అంతే యు ఆర్ గోయింగ్ ఫర్ ఏ ట్రావెల్ డెస్టినేషన్ కాల్డ్ FMGE ఎగ్జామ్ సో బీ రెడీ baggage binoculars everything being made ready going to picnic so what test should be done in a patient before starting anti-malarial drug G6PD right so he asked a very cheap chitka question but actually there is a terror point about it. What are all the list of drugs that G6PD deficiency people should not be given, which will lead to the hemolysis? Naskondi. G6PD deficiency drugs list that you need to by heart. Then what best describes the control of enzyme activity by phosphorylation and dephosphorylation? Enzymes become active and inactive based upon whether they are in a phosphorylated or dephosphorylated state. That's called covalent modification is what we need to basically remember. Mala raskondi. Competitive, non-competitive and incompetitive, competitive, non-competitive, ఇంకోటి ఉంటుంది మూడు ఉంటాయి దీంట్లో Vmax ఏమవుతుంది కే మైకలీ మెంటన్ కాన్స్టెంట్ ఏమవుతుంది మూడోది ఏంటి జర చూడండి సో యూ నీడ్ టు వన్ ఆఫ్ ద టైప్స్ కాంపిటేటివ్ నాన్ కాంపిటేటివ్ గూగుల్ మూడో టైప్ చెట్టు పైకి పూछे तो मिल जाता है आपको आपको भाई सब in the middle of the class don't ask me to go to Chettu Bhai फिर भी आप पूछे तो nowadays ChatGPT became my life right if I have to decide whether to fight with my girl or not I'll type is this issue worth fighting ChatGPT will say oh no please don't do that you don't have that much life to scream and shout and fight to prove that you are right then suddenly I'll change my mood and come back and tell my girl oh sorry honey your point is right you want a villa okay we'll buy the villa no problem so hey మూడో టైప్ ఏంటమ్మా నాన్ కాంపిటేటివ్ కాంపిటేటివ్ కాంపి నాన్ కాంపి దీనికి మొత్తం కూడా చెప్పకలే చెట్టుపైకి కాంపి నాన్ కాంపి వాట్ మోర్ ఇన్హిబిషన్స్ ఫర్ FMG it will tell competitive okay non uncompetitive మరి uncompetitive में both Km and Vmax decrease inhibit non-competitive లో Km unchanged Vmax decreases Whereas competitive में KM increases, Vmax unchanged. Competitive में देखो चट्टू को पूरा बोलने की जरूरत भी नहीं है. Compy, non-compy, what more for FMGE? It will tell.
Same graph ichi last but 1 year lo is
Oh,
Oh, sorry. Our
relation.
online classmates can't see our ChatGPT screen, no? Okay, no problem. So, yeah. So please read the table. You see, you develop a mechanism by which how to remember. See, when father of Mr. X died due to colon cancer, Mr. X comes for colonic screening. What level of prevention? Remember, what is primordial before the emergence of the risk factors? If you are telling that is primordial. Primary is risk factor को reduce करने का. Secondary, early diagnosis and treatment. Tertiary, rehabilitation. So इसमें क्या कर रहे हैं आप? अब्बा जान को कोलन कैंसर है बोल के बेटा जान ने आ गया colonoscopic screening को. Already he developed risk factor. And using colonoscopy, what you are doing, early diagnosis and treatment. That is the reason it comes under secondary prevention. Liklo. Levels of prevention for which type of level of prevention is a favorite question of the examiner. In a group of 60 patients, 12 cases died, calculate the case fatality rate. अगर मालूम है तो मालूम, नहीं तो मर गए. Number of deaths by number of cases into 100. But what is important? Never include primary case. What is meant by primary case, secondary case? स्कूल में रामू ने कंजंक्टिविटिस के साथ आए, सीनू को और भीमू को भी कंजंक्टिविटिस आ गए. सीनू और भीमू को कहते हैं सेकेंडरी, रामू को बोलते हैं प्राइमरी. राइट? Sorry, not in case fatality rate. It is in the secondary attack rate. There is one more thing.
Yeah.
इंदुलो सबको जो जितना भी मर गए उतने लोगों को ऐड कर लो. So high CFR means severe disease. So కాబట్టి ఇక్కడ ఏంటంటే number of deaths by number of cases. 12 died out of 60, but you need to know divisions, multiplications also. That also I will teach. No problem. Oh, they permit?
Yeah.
Oh.
There's a virtual calculator
Yeah, on the screen.
on the screen.
On the screen. I
Because
thought
you know that we are
if you take directly app only, you will open. Oh, on the screen. They know that doctors don't know calculations. In a group of 75 students, 80% are immunized. One student developed a fever with rash. After the exposure, 12 more children got affected. And the first one who got it is primary case. 12 is secondary.
Yeah.
So only you need to include the secondary cases. So 75 students, 80% are immunized. So how many are vulnerable? 20%. 20% of 75 is 15. So 15 patients, 12 patients are secondary cases. But so that means 12 by 15 into 100. Okay?
Number of secondary cases by number of vulnerable.
Susceptible. New cases by susceptible cases. మళ్ళీ ఇది రాసుకోండి. TFR, GFR, general fertility rate, total fertility rate, age specific fertility rate, తొక్కతోలు అన్నీ ఉంటాయి. అది వాడు చెప్పండి, ఎవరికి చెట్టుకు చెప్పండి, వాడు కొంచెం చేసి పెడతాడు. మంచోడే వాడు. వాడు నేషనల్ ఫ్యాకల్టీ, డాక్టర్ చెట్టుబాయ్. నా డాక్టర్ సెకండరీ అటాక్ రేట్ ఇది ఆర్ట్స్ రేషియో టీ స్కోర్ రాసుకోండి. ఆర్ట్స్ రేషియో టీ స్కోర్ ఎక్కడ వాడతాం? So basically there are two types of variables called discrete variable and continuous variable. What is the discrete variable? Are you pregnant? Not pregnant. There can only be yes or no answer. Ante. You love me or you don't love me. That's all. I try to love you, or I'll ask my daddy and tell. No, it doesn't happen. So that is what discrete variable. Continuous. Are you dumb? Yeah, I'm dumb in relation to him and brilliant in relation to him. So it is a continuous variable. I can be slightly dumber than him, but more dumber than him, severely dumber than him. Or are you, how many kilo weight you are? I can be 70 kgs, 60 kgs, 50 kgs, not altogether zero. Right? So they are called continuous variables. When you take the continuous variables, what will you do? You will take the mean value. 10 people are there. So 10 people का weight को continuous variable को mean value count करके another population में भी weight का mean value करके दोनों को compare करोगे, इसको कहते हैं T score. Student T score. There is no teacher T score. There is no principal T score. Only student T score, because that fellow who discovered that the dumb guy's name was student. The second type, discrete variable. How many of you are pregnant in this? 50 out of 100. Another population. How many of you are pregnant? 20 out of 100. You compare this 20 with that 50. Proportions. When you compare proportions, you call chi-square test.
Even in T, you are paired and paired.
Oh.
And again, chi-square is something just like
Oh.
most
Okay.
cases.
Yeah.
So, Kabad Raskondi. Odds ratio, chi-square test, student T test. One question invariably comes in the NEET PG. Now, doctor, a study was started in 2012 and recruited smokers and non-smokers. And in 2022, they checked who had developed coronary heart disease, what type of study it is. So 2012 से 2022 तक prospectively they are testing. That's the reason it is a prospective cohort study. Then what is case control study? Case हो गया.
Yeah.
Going back.
That means, let us say you took 100 divorces. How many of them have eaten last 10 years idlis prepared by their wife? That may lead to depression leading to divorce. We don't know. We are doing a study. Can you remember how many idlis you wrote? That's called recall bias. That's the reason case control studies mein recall bias is a big problem. But it is easy to do a case control study because you have cases ready-made. Just go back to their old medical records and then collate it, and by next day you give ChatGPT, it will give you the study. Prospective ante 10 साल उनको फॉलो करना, जब भी वो सिगरेट निकालेगा आप जाके नोट करना, इतने में आप मर जा सकते रिसर्चर. So a control cohort study is very difficult to follow. So Raskondi, case control cohort randomized control trial. 10 पॉइंट देने के लिए चट्टू भाई को बोल दो.
Odds ratio is done. Process. And you have relative risk case.
रिट्रोस्पेक्टिव प्रोस्पेक्टिव. MCQs को देख के बुक के पास जाना, केस कंट्रोल. These are cases. Go back. Control and the one who has zero disease. Case is the one who has actually disease. Adaka bias mala. There is nobody who has no disease completely. And the one who has, maybe in this guy, it may be in the early stages, ready to evolve. We don't know. So now, inko distribution curve raskondi. Normal distribution curve.
2-3 times.
Regular ide adutadi inke unte tokkala. हम 25 साल से पढ़ा रहे भाई. 25 बारिश देके 25 विंटर्स देके इनको 3 साल से, इस 25 में 3 साल देख रहे. Right? 68% fall in 1 standard deviation, 2 standard deviations by 95%, 3 standard deviations by 99.7%. ये पढ़ा, अगर ये पढ़े तो आप ज्ञानी हैं. और ये बेल कर्व में mean is equal to median is equal to mode. All the three are equal in normal distribution. ఇంకో 2 types of distribution curves ఉంటాయి. రైట్ స్క్యూడ్, లెఫ్ట్ స్క్యూడ్. అది రాసుకోండి. డిస్ట్రిబ్యూషన్ కర్వ్స్, నార్మల్, లెఫ్ట్, రైట్, స్క్యూడ్, చెట్టుబై ఇచ్చేస్తాడు మీకు పాయింట్లు. దాంట్లో ఏంటి? మీన్ మోర్ దెన్, మీడియన్ మోర్ దెన్ మోడ్, మోడ్ మోర్ దెన్ మీడియన్, మోర్ దెన్ మీన్. అది ఏ టైప్ ఆఫ్ స్క్యూయింగ్ చెక్ చేయండి. అట్లనే స్టాండర్డ్ డీవియేషన్, హౌ డు యూ క్యాలిక్యులేట్? ఫార్ములా, SD ఫార్ములా. మీన్, మీడియన్, మోడ్, స్టాండర్డ్ డీవియేషన్ ఫార్ములా. Now, what is the vaccine contraindicated in pregnancy? आ गया हमारा vaccine वाला question. Varicella. All live attenuated vaccines are contraindicated in pregnancy. But vaccines, all vaccines which are live, which are killed, which are both, and in case of Japanese encephalitis, 17D strain is the one which is being used. అట్లనే బీసీజీలో క్యాబ్లిమెట్రీ ఉంటుంది, చదవండి అది కొంచెం. నెక్స్ట్ డాక్టర్.
So even though only live vaccine which can be given still because it is 100% vaccine preventable disease.
ఏది?
Measles.
ఒకసారి చూడండి. అదే
అది నేను చెప్పాను.
అన్ని మొత్తం వ్యాక్సిన్ గురించి ఒక 50 పాయింట్స్ రెడీగా ఉండి టార్చర్ చేయాలి. రెడీగా రూమ్లో చేసేటోళ్ళం మేము. రెడీగా పెట్టుకునేది పాయింట్లు. ఎవడైనా ఎక్కువ మాట్లాడినట్టు మొదలు పెట్టేది. టప్ 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 మిజైల్స్, రైట్? So now one image will be given, symbols. All national programs, their symbols.
అవి నేర్చుకోలేదు.
Huh?
అవి టూ మచ్ ఉన్నాయి.
దాన్ని అడగండి, చెట్టు పైన అడగండి. FMGEకి కావాల్సిన లో అడిగే నేషనల్ ప్రోగ్రామ్స్ ఏంటి, ఒక దాని నుంచి 5 పాయింట్లు ఇవ్వండి అంటే మా మొత్తం తిప్పి కొడితే 10 పాయింట్లు. 10 నేషనల్ ప్రోగ్రాంలు, 10 × 5 50 పాయింట్లు, ఒక 10 సింబల్స్.
Sir, నేను book తీసుకొస్తాను.
ఏది?
ఈ book లో ఉన్నాయి sir.
ఎట్లున్నా పర్లేదు, ఎట్లా మీరు ఏం చేసినా చేయండి.
1.5 hours.
ఓకే, థ్యాంక్ యూ.
ఏ టైంలో ఇప్పుడు సి మార్నింగ్ ఐల్ కమ్, విల్ ఫినిష్ ఇది, దెన్ ఐల్ గివ్ ద హోంవర్క్ టు బి డన్. దెన్ యూ హ్యావ్ ఇది మన టెస్ట్ టు సాల్వ్. మీరు దాన్ని 3 సెగ్మెంట్స్ చేసి అకార్డింగ్లీ ప్లాన్. ఓకే. Girl in pink dress holding a thali is the National NL Leprosy Eradication Program. It's called Sapna mascot. Arre. It is used to reduce the stigma and promote early detection. Sapna. Very good. I'll go and tell. I'm a leper. Please watch a movie with me tonight. Stop a person's neglected ailment is sapna, leprosy. తెలుసా మీకు? వస్తుంది మరి రేపు నీకు నీట్ పీజీలో కూడా వస్తుంది. FMGలో వచ్చిందంటే అటు వస్తుంది. నెక్స్ట్, rabies prophylaxis in immunocompromised patient. So always remember, hepatitis B, rabies, specialty ఏంటి? Live vaccine plus immunoglobulin are given together, right? So generally we don't give any other places, only in these two. So basically passive immunity, active immunity, difference ఏంటి? Active immunity will create immunological memory, either a killed vaccine or live vaccine. Both will lead to active immunity. Passive immunity ante the one which you get by administering immunoglobulin or toxoid. That is all what passive immunity. That means it will go and block. If you give immunoglobulin, no, it will go and block the organism. It does not lead to any immunological memory. Adi passive immunity. Lot of people think killed vaccine is passive, live vaccine is active, and wrong. Killed vaccine or live vaccine, both of them are creating immunological memory. That's the reason they both come under active immunity is what we need to remember. Now, doctor. Usha worker. Asha అయిపోయింది Usha వచ్చింది ఇప్పుడు. Urban social health activists. I don't know. So many things are happening. Huh? Usha worker. How many population को Usha worker होना? Asha worker क्या करेगा? Accredited social health activist is Asha. Urban social health activist is Usha. अच्छा पढ़ो बेटे. One Usha per 1500 to 2000 urban population. One Asha per 1000 rural population.
Usha is nothing but urban Usha.
అర్బన్ ఆశ అంతే మరి. కాకపోతే ఇక్కడ 1000 రూరల్ కి, అక్కడ 1500 to 2500 అర్బన్ కి. షీ మస్ట్ బి ఫీమేల్ రెసిడెంట్ ఆఫ్ ద స్లమ్, ప్రిఫరబుల్లీ 8th పాస్. అమ్మ 7th పాస్ కాకుండా 8th పాస్ ఎందుకు? देयर इज नो एग्जाम फॉर 8th. नो बोर्ड एग्जाम 7th को भी नहीं है, 8th को भी नहीं है.
This is the last batch who wrote board for certificate. మా తర్వాత thesis.
అవునా? వావ్. సో but you should get the seat before NEET PG is removed. ఈసారి కొట్టేయాలి. ఇప్పుడు ఎంత తారీఖు?
13th.
13 July.
ఆగస్ట్ 2nd. కానీ 25th అయిపోతుంది, 24th అయిపోతుంది.
26th.
26th ఎగ్జామ్.
Yeah.
25th అంటే అసలు మనం ఒక్క నెల రోజుల ముందర మొదలు పెడితే బాగుండేది జుగల్బంది.
Sir, but
That's a beauty part. Look at a incurable optimist will look at the half full of the glass. empty. Always you should learn that.
I'm an optimist.
And that's most important. जो हो गया सो हो गया. अभी क्या है आगे बढ़े तो वो देख लेना. Which is the nodal ministry of disaster management in India? Ministry of Home Affairs.
We think
They are the ones who create disasters, no? They are the ones who create disasters, no? So, disaster, it is enacted in 2005. The nodal ministry is, atlane, what is the nodal ministry for midday meal program? Raskodi. Nodal ministries. Nodal ministries. Now, doctor, which is not a food adulteration disease. Fluorosis occur by water. Laterism, epidemic dropsy, aflatoxicosis. ఆ మూడు రాసుకోండి మీ దాంట్లో. ఎందుకంటే laterism is due to Lathyrus sativa. What is the toxin that is there in that? मस्टर्ड सीड से क्या मिलेगा? अर्जिमोन ऑयल से क्या मिलेगा? एपिडेमिक ड्रॉप्सी, aflatoxicosis. ఈ మూడింటి గురించి దానికి వచ్చి చెప్పమని చెప్పండి. చెట్టుపై దేఖలేగా. Then which is the IPV dose schedule under national immunization program? FIPV, fractional inactivated polio vaccine. మనకి మామూలుగా వేసే పోలియో ఏంటండి? లైవ్ అటెన్యువేటెడ్. అది ఇంకోటి ఏంటి? ఫ్రాక్షనల్ ఇన్యాక్టివేటెడ్ పోలియో వ్యాక్సిన్ ఈజ్ ఇది. అందులో మళ్ళీ సెబీన్ అండ్ సాల్క్ ఆర్ ద 2 types of vaccines. సో మళ్ళా దాని రెజిమ్ ఉంటుంది నేషనల్ ఇమ్యునైజేషన్ ప్రోగ్రామ్ లో. ఫ్రాక్షనల్ IPV. So now why this is used? Because if you use the live attenuated vaccine, which is used in all the pulse polio immunization programs, that live attenuated organism itself can lead to vaccine associated paralytic polio. Adi mitigate cheyadaniki they found FIPV. FIPV is given intradermally, left upper arm, and India has switched from TOPI and BOPI to FIPV in 2016.
P1, P2, P3. P2 is vaccine associated polio. P2 has been removed.
Okay.
P1 and P3 combination bivalent switch IP.
Is called
Bivalent OPV, sir.
OPV. Ah,
P2
good.
thesis, sir. P2 was the one causing vaccine associated
Polio. How often is National Deworming Day observed in India? Twice a year. 10th February before Valentine Day, 10th August. 5 days before Independence Day. Abba. Good, eh? Between 1 to 19 years. What do you give for deworming? Albendazole 400 milligrams. Single dose. 1 to 2 years. Half tablet, more than 2 years, the full tablet is being given. That's deworming andi. Ever chestar it is implemented by whom? So andukosame which programs are implemented by which ministry? Ministry of Health and Family Welfare in collaboration with Ministry of Education, because school children are there in the schools. Ashla. 2 shoes, 2 wands, 2 doses. February and August is deworming twice a year. అయిపోయిందా? टाइम कितना हुआ बेटे?
1:42. 1 hour.
8:30, yeah? Papa, 9 o'clock, Wimbledon, His Royal Highness. Thank you very much. I hope you all enjoyed the session. Always, Spardhaya, what do you say, Viraj? Today we enjoyed, no?